Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the world and return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the world. The topic of today is chicken pox. What is chicken pox? Chicken pox is also known as varicella. It is a very contagious infection caused by varicella zoster virus, so that it is sometimes called varicella. It mainly affects kids, but adults sometimes, mostly 90% in children under age of 2 years. It is generally mild in children, but in severe cases, spread to the nose, mouth, eyes, and even genitals. People only get chickenpox once. Reinfection by the virus occurs, usually do not cause any symptom. Now, here one can see this kind of picture on abdomen of the patient, and with so many crops of the different sizes and different shapes. So that is the chicken pox. It is caused by this virus which is called varicella zoster virus or chicken pox virus. It have got a double-stranded DNA genome, then nucleocapsid, tegument, lipid envelope, and glycoprotein spikes by which it to attach. So here again one can see glycoprotein spikes, lipid envelope, tegument, nucleocapsid, and double-stranded DNA genome. So this is the structure of the virus responsible for chickenpox. Etymology, how the term chickenpox originated is not very clear, but it may be due to being a relatively mild disease. So chicken is said to be a very mild, and we just sometime do use the those chicken dose, mean very minimum possible dose to any disease. So from that it has been derived from the chicken, that it is being a relatively mild disease. It has been derived from chickpeas, resemblance of the vesicle to the chickpeas, or rash resembling the chicken pecs. Other suggestions include name chicken for a child, literally child pox. So here one can see the chicken peas, and these have got resemblance with the lesion which are seen in the chicken pox. So that is chicken and peas, and that's why it is called. Now, history of the chicken pox. Since its introduction in 1995, chicken pox was not separated from smallpox until late 19th century. In smallpox, by contrast, at any time, all the lesions on the patient's body are in the same phase of their development, and there are ulcer, and these ulcer, when these heal, these leave the permanent scar mark on the face. For that reason, it is said to be causing the disfigurement, and it has got the scars because of this. In 1888, its connection to the shingles was determined. As you know, the chickenpox is the later life that appears as shingles after 30-35 years. The first documented use of the term chickenpox was in 1658. So here one can see the lesion of the smallpox. These lesions are the same. These are not having the different like papules, vesicles, and these are of the crops are the same lesion throughout the disease process. And when these heal, these leave the permanent scar mark causing the disfigurement. Now, epidemiology, chickenpox occurs in all parts of the world. Before routine immunization, number of cases occurring each year was similar to number of the people born. So every kid was just going to have this problem in his or her life. Since immunization, number of the infection has decreased about 90%, and only few people, those who are not immunized, are going to have this now. Now, other animals in which the chicken pox have been seen, humans are the only known species that disease affects naturally. But however, it has been seen in the other primates like chimpanzee and the gorillas. Now, causes of the chicken pox, that is, I have told you already, that is VZV, mean varicella zoster virus. It has the patient is having direct contact with the infected person, and pregnant woman. These are just going to have the vertical transmission to the baby. So these are the major causes of this chicken pox. Now, certain risk factors are that patient have not had virus before, patient have not been vaccinated for chickenpox, being under 10 years of age, work in a school or school care facility, late winter and the early spring season are notorious for spreading this problem. Chronic illness also favor the chickenpox infection. Weak immune system, similarly, mother exposed to the varicella zoster virus during pregnancy, and a fetus exposed to the varicella zoster virus because of the mother infection. It is said that good people are like candles. They burn themselves up to give other the light, and that is the sacrifice which they do good people for the others, like the candle, burn themselves but do the betterment for the others. Now, the spread of the chickenpox. Chickenpox is an airborne disease which spreads easily, and why that's so contagious. It is from one person to the next through cough and sneeze of an infected person. It may also spread through contact with the blisters, which do have the fluid and that is full of the viruses, by touching something on which particles have landed, via sneezing, via coughing, via speaking. So a person have taken that virus from there. One get virus by breathing in the particles that come from the chickenpox blister or the cough. Those with the shingles may spread chickenpox to those who are not immune through contact with the blisters. Chickenpox is most contagious from 1 to 2 days before the rash appears. Until all blisters are dried and crusted, the chickenpox is contagious. So here, varicella zoster virus is similar to herpes simplex virus in method of transmission, and as one can see that by spread by the respiratory route, a person inhales these viruses through the droplet, and these viruses go to the nerve fiber, sensory nerve fiber of the patient, and these are just going to the skin, and from here these are going to appear as the lesion on the skin, and from the dermis this goes to the epidermis, and then it is going to cause these blisters, which are the chickenpox blister. Now, pathophysiology. Exposure to the varicella zoster virus initiates production of the host IgA immunoglobulin A, then IgM immunoglobulin M, and immunoglobulin IgG antibodies. IgG antibodies persist for life and confer immunity. These appear late, but they do give immunity for the longer time. Cell-mediated immune responses are also seen. Varicella zoster virus now spread from mucosal and epidermal lesion to the local sensory nerves, as I have shown you in the figure, and from the sensory nerve it appears in the epidermis as the lesions. VZV remains latent in the dorsal ganglion cells of the sensory nerves, and reactivation of the VZV results in the herpes zoster or the shingle later in the life when they lie there in dormancy, and later reactivation lead to the herpes zoster. Varicella zoster can affect arteries in neck and head, producing the stroke, and either during childhood or after a latency period of many years. Now, here one can see the tonsil crypt and the lymphocytes. These are going to have these viruses from the tonsil, and then they go afferent lymphatic connected to the systemic circulation. From the systemic circulation, they are just going to reach to the nerve fibers, and from the nerve fiber, these are just going to the skin microvasculature, and from the skin microvasculature, these appear as the blister on the epidermis as the skin lesion of chickenpox. The saying of the great man that I am not handsome, but I can give my hand to someone who need help, because beauty is required in heart, not in the face. This is the saying of the great man who was President of India, Dr. Abul Kalam Azad. Now, the symptoms which the chickenpox do have, these appear within 10 to 21 days after contact with the virus. The first sign is feeling unwell, followed by the body aches, fever, feeling extremely tired, fatigue, feeling irritable, loss of appetite, headache. Within 1 to 2 days, the telltale sign of the chickenpox with super itchy skin, rash with red blister that do appear and confirm that it is chickenpox. After several days, blisters pop and start to leak and discharging the fluid which these blisters do have. Then they crust and scab over before finally healing. Till the time of the scab, they are able to spread the infection to the other, and these are the contagious lesion responsible for spreading the infection to the scratching sores can cause scarring. And here one can see the fever, the loss of appetite, the headache, and classical skin rash, sometimes cough and fatigue. These are all the sign and symptom of chickenpox. Most cases are mild and go away on their own, but one need doctor if the rash spread to one or the both eyes. The rash gets very red, warm, and tender, means bacterial skin infection, which make it warm and tender. Dizziness, shortness of breath, vomiting, stiff neck, one cannot control muscle pain, and fever over 100 degree, 102 Fahrenheit, dehydration. Chickenpox is rarely fatal. Vesicles occur on the mucous membrane, on the palate of the patient, can be in the nose, pharynx, larynx, trachea, conjunctiva, gastrointestinal tract, and the vagina. Here one can see the classical chickenpox, which is just like a dewdrop, and here these are the first sign and the first appearance of the lesion. Then it leads to become like this, and then it dries up to become scabby and have the crust. Symptoms occur in 3 phases. In the first phase, itchy, raised pink or red bumps called papules appear. These are about 250 to 500, and they pop up all over the body. In severe cases, it is seen in mouth, eyes, anus, or the genitals. Second phase is the bumps will turn into small fluid-filled blisters called vesicles, and they last one day, then they pop and start to leak the fluid which is inside. Third phase, these open wounds crust over and turn into scabs, and as they heal, new bumps continue to appear as the first phase, and one can have bumps, blisters, and scabs at the same time. So the new crops are coming with the first phase, and already that second phase going into the third phase. So here one can see the three phases: red or pinkish bumps and fluid filled blisters, the vesicles, and the crust which is just having the scab. Similarly, here it is macule, then it is macule which is not raised, then it is papule which is raised, then it is having the vesicle with the fluid. So these are fluid, and then there is the crusting, and that is the last stage. Now, one can spread virus to the other people until all spots crust over. Otherwise, a person remains contagious. The typical wall of the vesicle is so thin that it resembles a drop of water on reddened surface of the skin, that is dewdrop on a rose petal. As lesion dries and changes from a vesicle to a pustule, it umbilicates, looks like the umbilicus, and then crust over. In children, no prodromal symptom, and first sign is a rash or the spot in the oral cavity. The rash begins as small red dots on the face, scalp, torso, upper arms, and the legs. And one thing very important about the chickenpox is that it is said to be that most of its lesions are central. Chickenpox start with C, and central also start with C. So the most of the lesions are on the center, that is on the face, on the front of the chest, back of the chest, and less on the extremities. So remember the central distribution of the lesions. Blisters may also occur on the palms, soles, and genital area. So here one can see the symptoms of these are just first the red spot appear, then blisters, and then hard crust. And similarly, these are the scabs and the crust. Now, the early prodromal symptoms in adolescents and the adults are nausea, loss of appetite, aching muscles, and headache, followed by the characteristic rash or the oral sore in oral cavity and the tonsil area. Malaise and a low-grade fever signal presence of the disease. Oral manifestation of the disease, internal rash, enanthem, not may follow external rash, exanthem. At the blister stage, intense itching is usually present. So here one can see the blisters inside the mouth and the palate, then in the eye and the forehead, on the back and the shoulder, on the arm and the legs, on the hand,